Welcome back to the deep dive. You've sent us your reading list articles, research papers, notes, and our job is to, cut through the noise and deliver the insights.
And today, we are really diving into something fascinating.
We are. It's a condition that shows the profound and often pretty painful link between the mind and the body. We're talking about neurodermatitis.
Right. And sometimes, clinically, it's referred to as neurotic dermatitis.
Okay.
It's a chronic skin issue. And it's marked by just one overwhelming symptom.
Which is?
Intense. And I mean really intense, often uncontrollable itching.
And that itching, it leads to a very specific, very visible result on the skin.
Exactly. Patches of thickened, irritated skin.
When you see those patches, you're literally looking at the body's physical response to constant inflammation and nerve stimulation.
Okay, let's unpack that, because that's where the surprise is, I think.
Yeah.
This isn't just a typical allergic reaction that pops up and then goes away.
No, not at all.
We're talking about a vicious, self-perpetuating loop. It's called the itch-scratch cycle.
So our goal today is to understand all the layers of this that causes stress, genetics, even friction.
And the symptoms, like that characteristic leathery skin.
Yes. And then, crucially, to look at the treatments, both physical and behavioral, that you need to finally break that cycle for good.
It's a phenomenal example of what we call psychodermatology in action. The really fascinating part is how emotional strain, the stuff we think of as purely internal.
Right, in your head.
How that shows up as this persistent, visible, physical discomfort. Recognizing that link is really the first step.
Absolutely. So let's start at the beginning. If someone's hearing neurodermatitis, where does that fit in the family of skin issues? Is it just a fancy word for eczema?
That's a super common question. It helps to think of it like a family tree.
Okay.
Neurodermatitis is a type of eczema. Specifically, it's under the umbrella of atopic neurodermatitis.
What's related?
It shares the chronic inflammation, but its defining feature is that the severity, the lesions, they're driven by scratching, by trauma, which in turn is often triggered by nerve sensitivity or emotional stress.
So if eczema is the big category, neurodermatitis is the specific type defined by that psychological driver.
Precisely.
But just to make it clear, there are other types of eczema that look really different. We should probably flag one of them.
Yeah, for contrast, you could look at something like dihydrotic eczema. It's also called Pomphylix.
How is that different?
It presents very differently. It causes these small, really itchy, fluid-filled blisters.
Oh, blisters, not thickened skin.
Right, and they're usually on the palms, the soles of the feet, the sides of the fingers. Stress can trigger it, for sure, but the visual is the blister, whereas with neurodermatitis, the defining visual is the scratching and the thickening that results from it.
That distinction is key. Okay, so let's focus on the physical reality of neurodermatitis. What are the, say, 4 hallmarks you'd be experiencing?
The primary one, the engine for the whole cycle, is persistent itching.
And it's not a small thing.
No, it's not a minor annoyance. It's described as intense, unrelenting. It often comes in waves, and it's especially bad at night or, when you're trying to rest. The urge to scratch is it's irresistible.
Which is how it becomes chronic.
Exactly.
And that scratching leads directly to the second defining symptom. It's a clinical sounding term, lichenification.
It sounds complicated, but it's very physical.
So what does it look and feel like?
Lichenification is the body's defensive response to constant trauma.
So the body is trying to protect itself.
It is. Think of it like this. If you keep rubbing a rope, it's frays. If you keep rubbing your skin, the body thinks it's under attack and it decides to, toughen up.
It builds armor.
Pretty much.
Yeah.
The skin thickens, it gets rough, the normal skin lines become really exaggerated, and that gives it that leathery texture.
That's the leathery skin people talk about.
That's it. And the patches often look darker, more textured than the skin around them.
It's like a physical memory of stress, the scar tissue of a nervous habit.
That's a great way to put it. Beyond that, the skin also shows dry patches.
Why?
Because the inflammation damages the skin's barrier, so it loses moisture. That leads to flakiness, cracking.
And I imagine that's painful.
Very. Which brings us to the 4th symptom, sore or scaly areas. The scratching breaks the skin, so you get these raw, tender patches that can sting or burn.
And that opens the door for infection.
A huge risk. Secondary bacterial infection is very common.
Okay, so we have the symptoms, which are mostly from scratching, but what starts the fire? The The research really hammers this home. The psychological driver is massive.
It's absolutely central. That's why we often call it stress neurodermatitis. Emotional strain, anxiety, mental fatigue.
Mm-hmm.
They aren't just coexisting with the condition.
The triggers?
They are direct chemical triggers. Stress hormones, like cortisol, they affect the nerve endings in the skin, making them more sensitive and just, amplifying the itch signal. The nerve fibers become hyperreactive.
Which explains why it's so confusing for the person experiencing it. They say the discomfort often shifts in different body areas.
Yes. They might treat one patch successfully, and then the deep, irritating itch just appears somewhere else. It adds to the mental fatigue.
It's that perfect vicious cycle you mentioned earlier.
It is. The stress sensitizes the nerves, which causes itching. The scratching damages the skin, causing visible, painful lesions.
Which then makes you more anxious or embarrassed.
Precisely. And that distress leads to more stress hormones, and the cycle just continues, completely unbroken.
So the mind-body link is number one, but what else is stacked against you, even if you manage your stress perfectly?
Genetics. Genetic predisposition plays a huge role.
So if you have a family history of, say, asthma or allergies.
Exactly. Asthma, eczema, allergic rhinitis, hay fever. If that's in your family, you have an inherited sensitivity. Your skin and your immune system are just wired to be more reactive.
Then you have the external triggers, just physical stuff, friction and irritants.
That's where the environment comes in. Repeated rubbing, even minor rubbing, from tight clothes, a watch band, a stiff collar. That's enough to start a flare-up.
And what about irritants?
Things like harsh soaps, heavily fragranced detergents, or even contact allergens like nickel and jewelry, they can breach that already weakened skin barrier and start the itch response.
The research also mentioned internal shifts in the body.
Yes, internal factors. Hormonal changes are a big one.
Like during menstruation or menopause?
Menstruation, pregnancy, menopause. They can all intensify the dryness and itching because they alter the skin's natural lipid barrier. And certain chronic illnesses, like diabetes or thyroid disorders, can also compromise the skin's resilience.
Let's talk about the where, the geography of neurodermatitis. The locations on the body seem to tell a story.
They're incredibly diagnostic. The neck, the sides, and the back is a classic site.
Why there?
It's a double whammy. It's a high-friction area from collars and scarves, and it's a place where stress-related muscle tension often manifests. So a persistent scaly rash on the neck is the very common sign.
And then there are the places you can reach easily, right? Like the wrists and forearms.
Exactly. Those are spots we can scratch unconsciously, even in our sleep. The research points out that scratching in sleep is a major, major factor for these locations.
And then you have the warm, moist areas.
Right, the groin and the back of the knees. Sweat, warmth, tight clothing, it all aggravates the symptoms there.
And I saw an important note for listeners about the groin area.
Yes, this is critical. Neurodermatitis in the groin is very often mistaken for a fungal infection. Both cause redness and discomfort in that area.
That makes sense. What about the lower legs, the ankles and thighs?
Major friction points from socks, shoes, just the act of walking. That constant trauma is why you often see the most dramatic cases of thickening. That hard, leathery skin on legs in those spots.
And finally, the scalp.
The scalp is so challenging because the hair makes it hard to apply treatments. And the itching there is often triggered by a mix of stress and, product buildup.
So if you're listening and recognizing these symptoms, how does a dermatologist confirm the diagnosis and rule out things like psoriasis?
It starts with a thorough physical exam, looking for those telltale thickened patches and discoloration. But just as important is the patient history.
What do they need to know?
Your itch patterns, how stress affects you, how long this has been going on, the whole story.
But they often need more than that for confirmation.
Usually, yes. A small skin biopsy can be the gold standard to rule out mimics like psoriasis. And allergy testing is also key.
To find those external triggers.
Exactly. If it's your detergent or a metal that's constantly irritating you, you have to identify it to break the cycle.
Okay, let's pivot to treatment. Since this is a battle on two fronts, the skin and the nervous system, the treatment has to be too.
It has to address both simultaneously.
So, physically, what's the first line of defense?
Topical corticosteroids. These are the standard. They're anti-inflammatory creams or ointments that calm the immune response in the skin. They reduce redness, swelling, and most importantly, they dampen that hyperactive itch signal.
But you have to be careful with them.
Very careful. Long-term, improper use can lead to skin thinning, so you have to use them exactly as prescribed.
What about something to help internally, especially for disrupting the cycle at night?
This is where antihistamines are crucial, especially the sedating kind.
And not just for allergies.
No. Their main role here is to reduce the severity of nighttime itching. When you scratch in your sleep, you guarantee the cycle continues. Interrupting that is a key strategy for healing.
And what about repairing the skin barrier itself? The dryness.
Daily, meticulous moisturization. It's non-negotiable. And we stress using thick emollients creams or ointments, not thin lotions.
Why is that?
They're just much more effective at restoring the skin barrier and sealing in moisture. The best time to apply is right after a bath when the skin is still a bit damp.
For the really stubborn cases, there's a more advanced option.
Yes, light therapy or phototherapy uses controlled doses of UV light to reduce inflammation and itching at a cellular level. But this is for moderate to severe cases and always under strict medical supervision.
But here's the thing. All of these physical treatments are they're just patches if you don't address the core behavioral problem.
You're absolutely right. You can't solve a nervous condition with just medicine.
This is where the psychological side of treatment is essential.
The long-term success of treating neurodermatitis hinges on behavioral treatments,
Like what?
like cognitive behavioral therapy or CBT. It helps patients identify and change the thought patterns that lead to stress and anxiety.
So you reduce the trigger at its source.
Exactly. And there's also a specialized technique called habit reversal.
What's that?
It helps you become hyper-aware of your scratching habit, which is often unconscious, and then substitute it with something that isn't damaging.
Like what? Applying pressure instead.
Applying pressure, using a cold compress, it's about retraining the nervous system not to respond to the itch signal with trauma.
So for at-home management, what are the quick takeaways?
Okay, first, rigorous avoidance of irritants. Fragrance-free products, gentle cleansers. Second, wear loose, breathable fabrics like cotton or bamboo to minimize friction.
And when you feel an itch start?
Use the behavioral techniques. Apply a cold compress or an anti-itch cream immediately. Do not scratch.
And of course, manage your stress.
It's not a luxury. It's medicine in this case. Yoga, meditation, deep breathing practice daily. They lower the emotional tension that ignites the whole process.
What are the risks if you don't break this cycle? What happens long term?
The complications are significant. First and most immediate is infection. Breaking the skin lets bacteria in. You get redness, pus, swelling. That requires antibiotics right away.
And the skin changes themselves can become permanent.
They can.
Yeah.
Permanent changes like that deep, irreversible lichenification. You can also get permanent discoloration, either darker or lighter patches, which causes a lot of distress.
And the impact goes way beyond the skin.
Absolutely. The chronic sleep disruption leads to fatigue, poor concentration, and it slows down healing. And the discomfort often leads to profound emotional distress, anxiety, depression, social withdrawal.
Which tragically just feeds the core stress trigger again.
It creates an incredibly hard cycle to escape.
Let's clarify one last bit of terminology. We mentioned lichen simplex chronicus. How is that different from neurodermatitis?
Think of it this way. Lichen simplex chronicus is the descriptive term. It focuses purely on the physical result.
The leathery plaques themselves.
The physical skin changes. Exactly. While neurodermatitis emphasizes the neurological and psychological triggers that started the itching in the first place.
So two names for the same destructive process.
That's right. Both are driven by that same emotionally charged itch-scratch cycle.
So when do you stop the self-care and call a dermatologist?
The line is crossed when self-care isn't working. If symptoms persist for, say, 2 to 3 weeks despite your best efforts, if things are getting worse, or, and this is critical, if you see any signs of infection.
Oozing, crusting, swelling.
Anything like that, you need immediate professional help to prevent permanent damage or a serious infection.
This has really illuminated how inseparable the mind and skin truly are.
It's a powerful example, and it demands a balanced, holistic treatment. The message is that you need physical intervention to repair the skin and psychological support to calm the nervous system.
So stress management isn't just a nice to have.
It's a core, medically necessary part of long-term healing for this condition.
And that leads us to our final provocative thought for you, the listener. We've seen that anxiety and emotional tension can physically thicken your skin, this process of lichenification. So what other silent physical manifestations of stress are we currently ignoring?
It's a profound question. If your skin is signaling distress this clearly, what is the rest of your body trying to tell you?
Something to think about. Thank you for joining us for this deep dive.
See you next time.